Why does Donald Trump seem to hate Tylenol? We are asking that question because on September 22nd, the US president launched a new offensive, this time against a common pain reliever called Tylenol. In fact, he told pregnant women to avoid Tylenol, claiming that the painkiller could be linked to autism. But here's the issue. He made the statement without actually giving out evidence. He did not cite science. He simply said this. Millions were listening.
Since 2000, autism rates have surged by much more than 400%. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good.
The President of the United States of America seeming to give unwarranted medical advice like a qualified medical doctor without any proof. He is telling pregnant women to tough it out rather than take Tylenol. Not surprisingly, experts, pediatrics, autism fields immediately expressed alarm over the claims. While a number of studies have shown a possible association between Tylenol and autism, others have not. None have proved causation. Medical experts, including the American College of Obstetricians and Gynecologists, saying that Tylenol is safe to take during pregnancy in consultation with a doctor. Now, this is not the first time that Donald Trump has made such medical statements seeming to be unsubstantiated. Remember, in his first term itself, he encouraged Americans to try unproven treatments for COVID-19. We all remember how that went down. Donald Trump is no doctor, last time we checked. Yet, here we are all over again. Trump, the president of the US, once more making medical claims, giving out medical advice with zero concern, it seems, for the consequences of his words and statements.
Trump's administration seemed to have misunderstood the available evidence. We do not find support that paracetamol in pregnancy would cause autism. I think that this is an alarming message and it's an ill-backed message.
And as for why Trump is pushing this, just to understand that, we need to first understand what research so far actually says. The findings have been mixed, not exactly conclusive. One study in the year 2008 did find some association between Tylenol use in infants and autism. But the finding was not definitive and researchers called for more analysis. Then, in 2019, a Johns Hopkins study pointed to a possible link in the womb. But a massive study in 2024 of 2.5 million siblings born in Sweden over 25 years found no increased risk of autism whatsoever. And earlier this year itself, a review of 46 previous studies said that maybe there is an association, but gave no proof of causation. Even Tylenol's maker has cited independent science that says there is no causal link between the ingredient in Tylenol and autism. Now, autism, having rates of autism diagnosis, have the rates of the diagnosis increased? In short, yes, diagnoses have risen sharply in the US. In 2024, a study found that autism diagnosis rate increased by 175% in over a decade, to be exact. But here's why the definition of autism was broadened in the 1990s to also include Asperger's. Diagnostic testing expanded, catching cases in teens and young adults, and not just children. And today, in 2022, 1 in 31 8-year-olds in America were diagnosed with autism. Boys 3 times more than girls, by the way. And that's not Tylenol. That just basically means better detection. And now here's the danger when it comes to Donald Trump's claims. Doctors actually recommend the ingredient acetaminophen for pregnant women. The lowest effective dose for the shortest period of time for many. It is the only way to treat those issues that pregnant women should avoid taking drugs for. Why is that? Because alternatives can cause kidney damage in the unborn child and lower amniotic fluid. In fact, the American College of Obstetricians and Gynecologists saying that the ingredient acetaminophen is one of the only safe pain relievers for pregnant women, and patients should not be frightened away from taking the drug. And the real threat is not Tylenol, it's fever itself. A high fever in pregnancy basically raises the risks of miscarriage, even fatal birth defects. So when Trump tells women to just quote unquote tough it out, what he's really doing is putting lives at risk in a way. So here we are, a drug trusted for decades, the only safe painkiller for pregnant women, it seems, suddenly under political attack, not by scientists, not by doctors, but by President Trump and his team of political loyalists. So the big question still hanging in the air, why does Trump seem to hate Tylenol? Is it about science or is it about politics?